Today, we are going to review the medications that are included in your Northwell Hospice Care Comfort Box. There are medications included in this box to treat a variety of symptoms. Your loved one may never need any of these medications, but we want our patients and families to be prepared should a symptom arise. You will notice the box is sealed with stickers. Please do not open the box until the nurse instructs you to do so. Store this box in a cool, dry place out of the reach of pets and children. First, let's look what's included in the box. Then we'll discuss how to administer the medication. When you open the box, first you will find a list of the medications and their dosing. The first medication you will see is morphine. It has a red sticker on the package. The dose is 5 milligrams and can be administered every 4 hours as needed. Something to keep in mind is that the dose is started low and could be raised if symptoms arise. If your doctor feels morphine is not the best option for you, they will be prescribing hydromorphone. The dose for this is 1 milligram. It can also be administered every 4 hours as needed, and it is used for pain or shortness of breath. Next, in the packages with the blue sticker is lorazepam. The dose is 1 milligram. It can be administered every 6 hours as needed for anxiety. Located in the bottle with the orange sticker is ondansetron or Zofran. The dose is 4 milligrams. It is administered every 6 hours as needed for nausea and/or vomiting. In the packages with the pink sticker, you will find a medication called acetaminophen or Tylenol in a suppository form. This medication is used if your loved one is having mild pain or fever and they are unable to swallow tablets. The next medication is used for excessive phlegm or secretions, sometimes known as a rattle or gurgle that can occur at the end of life. The medication is called hyoscyamine. The dose is 0.125 milligrams. It's given every 6 hours as needed, and it has a yellow sticker on the bottle. Lastly, you will find haloperidol. It is in packages that are purple or have a purple sticker. The dose is 1 milligram. It's given every 6 hours as needed for restlessness and/or agitation. Now let's discuss how we administer these medications. On the packaging, you will see them labeled as RDTs or ODTs. This stands for rapid dissolve or oral disintegrating tablet. This means that the tablet dissolves ideally in the mouth and will start to work within 15 minutes or so. If the patient is able to, have them raise the tongue and then just place that tablet under the tongue. If they're able to follow instructions, instruct them to just allow it to melt. If they can't follow instructions and they swallow it, that's okay. It just might take a little longer to work. Now let's look at a couple of ways to get the pill to dissolve. If the patient's mouth is dry and they're able to, have them take a sip of water and then place the pill, like we discussed, under the tongue or on the side of the mouth. If they're unable to swallow water, take a mouth swab or toothette, dip it in some water, moisten the mouth, and place the tablet in. Another tip to get the tablet to melt easier is to open the tablet like so, place it onto a spoon, and using the syringe that's provided in the box, you can draw up a little bit of the water, place it onto the tablet like so, give it a few seconds to become paste-like, and then you take that paste and you can put it in between the cheek and the gum and allow it to melt there. Now let's talk about how to administer the suppositories. You're going to need a pair of gloves for this. You're going to take the suppository out of its packaging, and then using a gloved hand, you insert the suppository into the rectum. At times, you may be instructed by the nurse to administer a medication for a symptom that may not be listed on the package. That's okay. They've collaborated with the doctor and it is safe to do so. Other times you may be instructed to administer 2 medications at the same time. This is also very safe. We hope you found this video helpful. But at any time, if you have any questions or concern, please call us at Northwell Hospice Care. We're here for you and your loved ones 24 hours a day, 7 days a week.